name is Irina Makarevich, and I'm a chair of biology department at Hamline University and a member of Pre-Health Advising Committee. I want to welcome you to this short presentation about Hamline pre-health programs. Pre-health programs are not particular major, but if you are interested in entering medical program or dental school or pharmacy school or veterinary school or PA or PT or OT programs after you are done with your undergraduate education, you're in the right place. Those programs have many things in common. For example, they all prefer well-rounded students with solid academic credentials. They want to see students who completed many different science courses, but also many non-science courses. They want to see students with strong writing skills. They want to see students who can show passion for their career choice. And one of the best ways to show that is to have extensive record of patient care and community service. Most of those programs prefer students who have some sort of research experience because many skills you get during research experiences are very important for those programs. And many admission committees look favorably upon students who have a record of working with underserved populations, diverse groups of people, and underprivileged communities. So you might want to start thinking now about what types of experiences you want to collect while at Hamline. Hamline's website has additional information about those programs, and I want to welcome you to do some investigation there. If you Google Hamline pre-health programs, you will get there and you can explore those a little bit further. I want to talk a little bit more about what types of experiences you want to be looking for during your undergraduate education to be a good candidate for those medical and healthcare professional schools. One of the first questions that people usually ask is, what is the best major to prepare for medical school? And the short answer is that there is no best major. You can major in many different fields. If you look at the data for people who are admitted to medical colleges through the American Association of Medical Colleges, you can see that majors simply do not matter when it comes to getting accepted to medical school. About 50% of people who enrolled in medical schools in 2015 were biological science majors. About 50% majored in humanities, social sciences, or physical sciences. Specifically, at the University of Minnesota Medical School, 17% of the applicants came from not science or not math majors. And in the incoming class of 2016, a total of 53 different majors were represented. There is really no significant difference in the performance of science and non-science majors in medical school board exams. This is a complicated chart with many different numbers, but this is specifically students who entered medical schools in the United States, separated by their primary majors in 2018-2019 academic year. What you can see is they come from a bunch of different majors, from biological sciences, humanities, math, physical sciences, social sciences, and others. Approximately 32% of students in 2018-2019 academic year were not natural science, math, or healthcare majors. Medical schools do not care about your major as long as you complete the prerequisite coursework and do well in school overall. So when you are choosing a major, you want to think about several things. First of all, you want to pick a major that if you don't get to go to a medical, you will be happy with. So think about plan B and plan accordingly. Many pre-med prerequisite courses have labs, and those labs take extra time. So when you schedule your other courses, not your pre-med requirements, not science courses, you want to think about potential scheduling conflicts. You want to pick a rigorous major that you can defend and you can talk about in your letter. You want to show that you are passionate about this major and that your choice is reasonable and comes from your passion from within. High GPA in non-science courses typically does not compensate for low grades in science classes. So even if you are picking non-science major, you still need to do really well in your science pre-med prerequisite coursework. Prerequisites for applying to medical school vary between different schools. And I'm talking about medical schools specifically now, but dental schools, pharmacy schools, veterinary schools have similar prerequisites. And I want to encourage you, maybe not right now, but after you start, look through some of those prerequisites in the programs that you would be interested in applying to. But typically, most of those schools require 2 to 4 semesters of biology, so a year of introbiology, and usually genetics, bio, another year of biology with labs. They typically require 2 semesters of general chemistry with a lab. Most of the medical schools require 2 semesters of organic chemistry, at least 1 semester of biochemistry, 2 semesters of math, statistics, and calculus, 2 semesters of physics, 2 semesters of English, and usually at least 1 upper level English course, and coursework in psychology and sociology. Again, I really encourage you to look at specific schools where you would be interested in applying to see specifics, because many schools have slightly different requirements. So let's take a look at some of the students who were accepted into medical school last year and see what their scores and credentials were. So this is a table of all MCAT scores and GPAs for people who were accepted to the United States medical schools in between 2017, 2018, and 2018-2019 years. As you can see, here's the total MCAT score. The mean is around 505. It doesn't mean you have to have this number, but this is an average score. So if your number is a lot lower, you probably won't get in. But if it's a little bit lower, you probably can compensate by other experiences to be able to get in. Similarly, you can look at GPA for different courses. So total GPA on average is at least 3.5, 3.57. Again, different medical schools have slightly different requirements, and you are really encouraged to look at specific schools that you're interested in applying to. This is some statistics for incoming 2018 class of the University of Minnesota Medical School. Their average MCAT is slightly higher, 510. Their average GPA is a lot higher, at 3.8. And about 17%, about 20% of those students were first-generation students. The national acceptance rate to medical school is about 40 to 45%. This number is a lot lower for veterinary schools. So if you are interested in a pre-vet program, you want to look at those numbers a little bit more. Hamline's average acceptance rate into medical school is higher than average. And it's relatively stable throughout the years. We have 8 to 10 people apply annually, and depending on some numbers, usually about 65, 68, 70% of students get in. I want to share with you some of the pictures of students who were recently accepted to healthcare professional schools from Hamline with their degrees and where they are at. So Justice Spriggs just graduated from Hamline with biochemistry degree, and he is now in medical school at the University of Minnesota. Uriel Vasquez entered and started his training at the University of Minnesota dentistry program. He graduated in 2018 with a biology degree from Hamline. Kristen Berry is in PA school right now in Baylor College of Medicine, and probably actually is very close to finishing. Farhood started in College of Pediatric Medicine in DMU. So you can see that it's not only medical schools that we are talking about, but there are other programs the students are interested in and are applying to and are getting into. There's some more names here, again, from medical school to dentistry school to pharmacy school. MedPred is in there right now. PA studies programs. And you can see that many of our students go to the University of Minnesota because they're close, but it's not the only choice for our students. I want to specifically highlight Fatima Mohammed, who is an MD PhD University of Minnesota program. It's a very competitive program where students study for 8 years. They receive 2 degrees, MD and PhD together, and they don't have to pay for their MD part of the education. So there are pluses to get those programs, but they are really, really competitive and they are difficult to get to. We have Hamline students who now study in those programs, and Fatima is not the first our student there. You can see that other students went to College of Pharmacy, to medical schools in a variety of different places, even as prestigious as Brown University, pediatric medicine, dentistry schools. Hamline students go to all of those places and are accepted in there. It is the reality, and you can be the next one. We are trying to keep track of our students who go to different programs. So Kelly and Natalia went to DO schools in different states. And that's another option for students who are interested in pre-health programs. I want to welcome you to Hamline pre-health program. And I hope that this presentation at the pictures of the students who were there some time ago. They started their programs and they were wondering what they want to do and what programs will they be able to attend. And now they're there and they've finished and they're successful. You could be the next one. And I hope that this program at Hamline will help you succeed with your career choices. Thank you so much and good luck. I hope to see you at Hamline next year.